Our world today, you have people that are just mean. They don't care about themselves, and they certainly don't care about you. And if they don't get what they want, then they're going to try and take their anger and aggressions out on staff.
Welcome to On Medical Grounds. Our guest for this episode is Mr. Todd Haines. Mr. Haines is here to talk with us about his experiences with violence in the workplace, especially in regard to healthcare workers such as emergency nurses and emergency department employees. Todd Haines is Director of Trauma Services in a Level 3 trauma center and a longtime leader with the Tennessee Emergency Nurses Association. Hello, Mr. Haines, and welcome to On Medical Grounds.
Thank you. Happy to be here.
Before becoming a nurse, you worked in law enforcement. At a recent rally in Washington, D.C., held to raise awareness of the threats and physical assaults encountered by emergency nurses and doctors, you said, and I quote, "I have been verbally and physically assaulted more times in my 12-year career as a nurse than in my 10 years in law enforcement. Please tell me more."
Well, that statement surprises a lot of people. Most don't understand that nurses and staff go through, especially in the emergency department. With the sheriff's department, I knew people would be mad at me for things that they did and would take out all their aggressions on me by threatening me or my family, trying to get a reaction from me. Occasionally, one would just go ahead and try to swing because, believe it or not, most people don't want to be arrested and go to jail. At that time, I was focused on just them, so it was a whole lot easier to plan for and take steps to stay ahead of the situation. Plus, times were a lot different back then. But as a nurse or as a provider in the emergency department, you're focused on so many different things, and you're not focused on one-on-one with the patient. You're focused on, so a lot of things, assaults happen. It was just a way of an opportunity, so to speak. Also in the emergency department, you have to understand the types of people that we're dealing with and encountering. Our emergency departments are experiencing a high volume of patients, and we're also not only dealing with the patients, we're dealing with the patients' families and their emotions. And those emotions get high when you're dealing with families with sick patients. We also deal with people that are very drunk, strung out on drugs, or have acute mental health issues. And then again, our society is much different. Our world today, you have people that are just mean. They don't care about themselves, and they certainly don't care about you. And if they don't get what they want, then they're going to try and take their anger and aggressions out on staff. The sheriff's department back in the early 1990s, our society and our world was a whole lot different than it is today.
Wow, you make a lot of good points. According to a survey from National Nurses United, around 31% of hospital nurses believe they have witnessed a notable increase in workplace violence during the COVID pandemic. Is this your experience as well?
Oh, yes, ma'am. And that's definitely been my experience since the pandemic for numerous reasons.
Do you feel that the restrictions on emergency department visitors and their family members during COVID played a role in increasing frustration and violence?
Oh, definitely. I do think it played a big role in increasing the frustration, certainly in the emergency departments, because emergency departments are the front door to the hospital. Also in the hospital as a whole, because you couldn't allow loved ones to go up and be with their family members, even their spouses, knowing that these patients were going to soon be taking their last breath. It was heart-wrenching for us. And then add on to that the frustration and anger from people because depending on where they got their information from, COVID, especially the Delta variant, was political or fake. And as nurses in some areas, we were being blamed for furthering an agenda or the propaganda. Thankfully, that went away after a while, and people realized we didn't make it up, and it wasn't our fault. So it was just a really bad situation all the way around, but the anger and aggression in the ER has been building for a while.
So prior to the pandemic, do you think the violence was escalating?
I do feel like the violence in the emergency department had started increasing. I've been a nurse since 2010, and there has been steady increases in the violence in our AEDs. It was such an issue that most of my master's degree work was around violence in the ER and the solutions that surrounded it. This was in 2015 through 2017. When I graduated, there was so much information about the issue, and that was 2 or 3 years before COVID ever happened.
Mm. In your opinion, are more people leaving healthcare because of the violence?
I think violence plays a large role, although I do think it's a combination of violence, burnout from the demands of the job, because we're always being asked to do more. Nurses are always asked to do more, and especially in the emergency department, because we're so busy most of the times that we don't have time to argue when we're asked to do more. We're just like, okay, and we make it happen as a team. I think pay has a little bit to do with it for some people. With COVID, the people that have been steadily at the bedside and working through the COVID pandemic, it's frustration when you can make the same amount of money or a little bit more doing something completely different with less responsibilities.
So, how about understaffing? Would this create a vicious circle with longer waits, more patient frustration, and more attacks?
I think so. I think starting with the COVID times, we became understaffed because our nurses were getting sick in the ER. People were leaving and taking travel assignments for much more money, and there wasn't a pool of nurses looking for jobs, especially ER nurses, to come and work during COVID times because they were very uncertain times for us. And I think the acuity and the sickness of the patients that we were seeing and still continue to see in the ERs, sometimes being short staffed, sometimes we just have more volume of patients than we have rooms. And it does create a lot of problems and a lot of tensions and a lot of issues because patients don't understand that the emergency department is not a first come, first serve environment, and that it's our clinical judgment that the patient having a heart attack that we're having to do CPR on has a higher priority than your sprained ankle or your medication refill. And it creates a lot of issues, especially in the waiting room, and a lot of tensions because people that are there for low acuity things that could have been handled by their primary care provider or by an urgent care provider, now are having long waits. And then by the time they do get back to the room, they're very angry because they've had to wait so long and see people coming in that are, quite frankly, much sicker than they are. And you tell them that they're not going to get their pain medications, or you take an x-ray of their ankle and it's not fractured, it's just sprained, here's some Tylenol. And then they've been waiting in the waiting room 3 or 4 times longer than it took for the physician to diagnose them and come up with their treatment plan. People do get very busy, very frustrated, and very angry.
Mm-hmm. So, what I'm hearing from you is maybe more patients should rely on urgent care rather than the emergency department.
Yes, ma'am, but if you think about our times, in the emergency department, we can't turn people away. If somebody presents to the emergency department, we have to treat them. We don't ever close our doors. We're open 24/7, and we're not worried about the money. Where if you go to an urgent care or a primary care provider, you're going to have to pay a copay or pay for your visit up front before they ever see you. So the emergency departments across our country have become very much of a PCP or a primary care provider for certain folks. And that creates a
I see.
much
Those are
more
important
volume problem.
distinctions.
Yes, ma'am, it is.
Mm-hmm, I see.
And we can't turn them away saying, no, this is not life threatening. This is not an emergency.
Well, Todd, you're not a small person. I would describe you as an imposing man. Do you think that size matters when it comes to patients intimidating healthcare workers?
I think so with a few patients. And with some of those patients, I can tell they'll look at me and go, you know what? Yep, you're right. And they'll just move along. But then you go back to patients with mental health issues or patients that are on liquid courage, alcohol or drugs, or people that are coming down from drugs that are not getting what they want. And no, I don't think size matters. It used to be in the emergency department that frequent flyers were always, or people that were always causing troubles, um, cussing, wanting to fight. So as a male, you would always get assigned those patients. Nowadays, it doesn't matter because you can't tell with some people what type of person they are. Are they going to be the ones that snap on you today? Or are they going to be the ones that if they don't get what they want, they're going to want to whoop you no matter what your size is?
So, are female workers more at risk than male workers because of their size?
I think female workers, or even just smaller workers in general, males included, especially in nursing and physicians in the emergency department or healthcare in general, are probably more at risk because, like I said earlier, there's a few people that my size will make just kind of a, yep, okay, and that's all it is. But not everybody's that way. And that's not the majority of people. So I think size may play a part in how angry or how quick to anger they are. But I don't think anymore in today's world that size is that much of a factor as far as people in today's society.
How about workers of color? Are they more likely to suffer abuse?
I think workers of color, they get lumped in with the rest of us. We're all nurses. So, no, I don't think that it's more dependent on the color of their skin. I think it's more the type of patient and sometimes the size of the person.
Mm-hmm. Now, this year, during my annual screening appointments, I've seen signage posted in the lobbies that outline policies toward patients who harass or threaten the workers. Do you think these posted policies help?
Oh, yes, ma'am. I believe that wholeheartedly. I think that if a person comes into the lobby of a hospital or an ER and they say a sign that says this type of behavior, angered behavior, will not be tolerated here, and you will be prosecuted, reported to the police, I think they do help. I do believe that they make a difference. They make a big difference because they set the expectation up front. I also think that these signs should be posted throughout the hospital so that that message is not ever forgotten.
The Workplace Violence Prevention for Healthcare and Social Services Workers Act. This was introduced to Congress by Representative Joe Courtney and Senator Tammy Baldwin. This bill takes critical steps to address emergency department violence. It would require the Federal Occupational Safety and Health Administration to issue an enforceable standard that would make sure hospitals and other healthcare facilities implement violence prevention, tracking, and response systems. Could you please tell me more about this bill and why you support it?
Oh, I would love to. This bill is Senate Bill number 4182, and it's important because there's no national standard for workplace violence in a hospital. One of the things this legislation will do is develop processes to identify and respond to the hazards that make emergency departments vulnerable. Sometimes design and layout make it easier for assaults or violence to happen. And sometimes, to get a nurse or a doctor around a corner or around a blind spot in an ER, they get lost out of sight. And this legislation would help troubleshoot those issues. This legislation will also implement protocols to document and investigate the violence. Right now, part of the problem is nobody really wants to report the violence because we know nothing is going to be done. We have people in our legal system that tell us it's part of your job. They're not going to prosecute. No, it's not part of my job to get beat up or threatened. My job is to help save lives and provide care for people. Another part of this bill is that it will create an environment that supports the staff to report incidents of violence and puts policies in place so that retaliation can happen. I think this bill will create an environment to where hospitals can further support its workers so that we can feel safe in reporting these incidents. And the fourth thing this legislation is going to do, it's going to help provide more training that helps to identify and address the problems in the workplace, like I spoke of earlier. But it's also going to help us fix them. This legislation in this section is going to help us get the training for staff to go through de-escalation techniques and crisis management so that we can be better equipped to deal with the violent person.
Mm-hmm. Where is this bill now?
The bill was introduced in the Senate on May 11th, and has been referred to the Committee on Health, Education, Labor, and Pensions. I can't find the date when this committee will meet or an agenda for the committee. It does have 26 co-sponsors, both Democrats and independents. However, no Republicans have signed on as co-sponsors as of yet.
Mm-hmm. As voters, how can we support the bill?
That's a good question. The best way that a voter can support this bill and support their healthcare staff, especially in their community hospitals, is to call their senators and their senators' offices. Tell them, please support Senate Bill 4182. Because I'll tell you right now, when you come into the emergency department or come into the hospital, we don't care whether you're Democrat, Republican, Independent, what color you are, or what color you relate to, red, blue, purple, whatever. We're going to take the best care of you that we can, and we're tired of getting assaulted, threatened in the processes of doing our job. We want to be able to do our jobs as safely and as stress-free as we can.
As a potential patient, what can I do personally to make the workplace a safer and saner place for emergency doctors and nurses?
That's another good question. You can, I would say, first off, realize that we have your best interest in heart. And we got into healthcare, especially in the emergency department, to help people. Just understand that while it may be an emergency for you, what we see as highly trained emergency department staff, it may not be an emergency for us. But the baby that we're having to do CPR on, we may not be able to stop and get you a warm blanket. And yes, I have been told that I see you're really busy in there with that baby. I'm not really sure what's going on, but how come I can't get a warm blanket? That's very frustrating to nurses. And we were doing CPR on a patient that was 6 months old. And, that's not necessarily a rarity, but understand that we're doing the best that we can and that it's not a first come, first serve environment.
I understand in the past you were often called upon to manage aggressive or agitated patients. How do you approach these patients, and what seems to work the best?
Back in the day, I was the biggest one around. So, yeah, I got called in to handle the biggest patients or the worst patients or the most agitated patients. And a lot of times, if you're calm and you're a neutral party that comes in, you can just listen to them, let them vent. And most of the time, they'll calm down. But sometimes here lately and more recently, no matter what size you are or how calm you are, or how well you maintain your emotions and your attitude, the situation is just going to escalate.
Unfortunately, 4 people were killed in a shooting at a Tulsa, Oklahoma medical complex this week. This included the doctor who had performed back surgery on the shooter earlier this month. Would you care to comment on this?
I would love to. That just goes to the breakdown in our society, because this patient, from what I understand in the medical world, is that this patient had been consistently calling the physician's office wanting more pain medicine, and was not able to get it. And so he got to the point to where he blamed the physicians and the people around it for him being in pain and not being able to get additional pain medicine, which he was prescribed pain medicine, and not knowing where it went, whether it was sold or whether he just took it all at once or whatever. Then he decided to take matters into his own hands.
Before we close today, what were you hoping that I would ask you?
I was hoping you would ask me who does my hair. No, I'm just kidding.
For our listeners, Todd has a shiny pate. I would like you, if you could please again repeat the number of that bill that is currently in Congress.
That is Senate Bill 4182.
And the committee it is going to be forwarded to?
It is going to be forwarded to, it has been referred to the Committee on Health, Education, Labor, and Pensions. And if folks could just call their Senate office and have them support this bill, or even sign on as a co-sponsor. It passed the House bipartisan and by a large margin. And the Senate, is next.
Okay. That's good to know. Todd, we appreciate your efforts to advocate for emergency nurses and doctors and to increase our awareness of this issue. Thank you so much for taking time from your busy schedule to speak with us.
Thank you. It was a pleasure. It was really kind of fun.
Well, great. And thank you for listening to the On Medical Grounds podcast. We know your time is valuable. The resources that were referred to in this podcast can be found at onmedicalgrounds.com. Be sure to click the subscribe button to be alerted when we post new content. If you enjoyed this podcast, please rate and review it and share it with your friends and colleagues. This podcast is protected by copyright and may be freely used without modification for educational purposes. To find more information or to inquire about commercial use, please visit our website on medicalgrounds.com.